All right, good morning. My name is Akhil Sood, reporting for Room Now here in Washington, D.C. Today I have the pleasure of speaking with Dr. Chris Wincup from King's College London. Hi, Chris. How are you today?
I'm very good. Thank you very much. It's nice to be here with you.
Absolutely. Yeah, so today I want to talk to you about CAR T in lupus. So just for the general audience, tell us a little about CAR T for the non-basic scientists from a clinical side.
Great. So I think CAR T-cell is an area of rheumatology that we're just getting to terms with. We're learning a lot from our colleagues in hematology with regards to this treatment. When I try to describe it to people, I say that this is a drug, but it's almost a living drug. What we're doing with CAR T-cell therapy is we're asking patients to typically donate their own blood, particularly their T-cells, which we all know as rheumatologists are important in the immune response of many of the autoimmune conditions we treat. And these T-cells are then taken to a lab and genetically reprogrammed to target something else, in many cases CD19 or BCMA, which we see on B cells. So it's a very, very extensive and precise way of B cell depleting. These new genetically modified cells are then reinfused to the patient, where they don't just stay dormant, they expand, they grow, and they find their target. So for example, B cells, and they deplete and kill those B cells, leading to a very profound B cell depletion. And what we're seeing in many of the studies, and bear in mind these are very small numbers and open label studies, is significant clinical response following that treatment. So it's a hugely exciting area. We're learning a lot from our colleagues in hematology, but one of the things that I'm talking about here an awful lot is how can we change this treatment? How can we look at using this treatment en masse for autoimmune conditions? So it's a really exciting time to be in this field and doing this type of work.
Absolutely, yeah. Thank you for sharing that. And my one question for you is, specifically in lupus, which patients would you be would you want to consider CAR T therapy for, and which ones would you want to be cautious for?
Yeah, so I think obviously with many of the typical trials that we do in lupus, we're looking for patients who tend to have more severe and refractory disease, and certainly that's where some of the data lies already. I think there's good reason for that. You don't know the long-term efficacy and safety of this treatment yet. So those patients who've exhausted many options, who have quite severe disease that if left untreated will lead to long-term consequences, tend to be the patients going into the study. That said, I think we're very good in the lupus community of saying what low disease activity or maybe remission looks like, but we perhaps don't quite have the terminology for someone who is hugely active in terms of their disease. And so there's a lot of debate in the field as to exactly what level of disease activity should we be using for CAR T-cell therapy. I think one of the interesting things is if we show that this is a safe and effective treatment that gets people into treatment-free remission, you may find that that level lowers in future studies and perhaps more moderately active disease is considered. But for the time being, it's really focusing on those with severe and active disease, refractory to at least a few lines of therapy.
And I see. And so I guess one question to follow up on that is that in the armamentarium of therapies that we're having coming out for lupus, where do you see CAR T maybe now or even in the near future as a line of therapy?
So I think this is one of the really exciting things about being here in Washington. So my first ever ACR conference was in Washington 8 years ago, where we were seeing a lot of data for a few biologics starting to come through, and that was all we were really talking about. And now here we are talking about CAR T-cell therapy, but a number of other targeted agents for the treatment of lupus. So I think this is a really exciting time to be looking after patients with lupus, to have so many promising agents coming through. I think in terms of the question of where this is going to fall in terms of treatment of patients with lupus will be predominantly decided by the long-term efficacy and safety of this treatment. If we see a period of efficacy that lasts for a number of years, then I think that really does suddenly say we need to use this in quite a lot of patients. If we find alternative agents that are very good at giving similar results that may be easier to deliver, then it might be that this therapy is used for those really sick, last-line evidence type of patients that need the most severe and profound immunosuppression. So I think we don't really know where this currently falls at the moment. There are some other interesting agents that are available, not just CAR T-cell therapy, but other cellular type therapies such as T-cell engagers. But this is a really exciting time to be here, to be here talking about a number of treatments that are really causing very profound responses. It's a long way we've come in the last 8 years since I was last in Washington, so I do think that we will probably know an awful lot more in the next 8 years' time, and there's a lot of reasons to be very optimistic here.
Absolutely. And do you envision CAR T leading us to a steroid-free era in the near future?
Yeah, so I think even if we take CAR T cell therapy out of this, I think we all need to be looking at steroid-free treatment, at least in the long term. I think steroids will always have their place in the short term when patients are very sick. But if we look at rheumatoid arthritis, and a lot of my job is looking down the corridors almost enviously at my colleagues who deal with rheumatoid arthritis, seeing they have many agents available to treat their disease. And it's very rare you'd find a patient with rheumatoid arthritis who is on long-term low-dose steroids. Now, we've not yet moved there with lupus, but as we see a number of agents, of which CAR T cell shows promise, but we know that other biologic agents are coming through, that we may have more options that mean that we don't need to leave patients on long-term steroids. And I do hope that we will get there fairly soon with the newer therapies that in particular are in later stage development that we do hope will come through in the next few years.
Absolutely. Yeah, thank you so much for sharing this. And this is really helpful and very insightful information regarding CAR T in lupus therapy, and really exciting in the present and in the future. Thank you so much for sharing the insights into CAR T. And this is Akhil Sood reporting from now. Thank you.